by quickly.
Most certainly does. Yes, sir. You got a lot of good things to tell us this morning,
We're going to do
as
our
always.
best.
All right, what are we talking about today?
We're going to talk about what to do after you've had shoulder surgery and it's still hurting.
Oh no. Okay.
How you like
And
that?
it's probably called Dr. Delp for help.
Well, there's options. That's one of them. But yeah, definitely. But there's other thought. A lot of people don't realize what has happened, but that's one of them definitely.
Okay, well let's go here. We're ready to roll, buddy. Here
I'm
we
ready
go.
to. I'm ready to. How do I get this camera back?
All right. Classic Country 98.1, Cousin Andy stepping back in the studio here for just a little bit. We got to check back in. We're gonna check in at the one and only Dr. Delp this morning. Dr. Adam Delp, his team, all about getting folks feeling better and getting them back to how they just feel good and the latest technology available, state of the art. They got it there at Dr. Delp's office. Dr. Delp, good morning. How you doing?
Good morning, cousin Andy. How are you doing today?
Doing pretty good. How's that for an intro this morning now?
I thought that was excellent.
Thank
Excellent.
you. I appreciate that. We spiced it up this morning, we think.
Keeping it fun, right?
Yes, sirree. Yeah. You had a good week?
So far, so good. It is Wednesday, so we're on hump day, so we're halfway there, right?
Boy, I'll tell you, we are. It seems like we all stay so busy, time just flies by, don't it, Dr. Delp?
It does. It really does. So,
Really, really fast.
and the
Yeah.
weather's starting to change. Things are good. I'm digging it.
Springtime is here, and yeah, we're loving the warmer temp. Although it's a little bit cooler this week, but some warmer temps on the way, and then a little cool down. But we're still in March, so we got to keep that in mind, too, don't we?
Spring is spring, but in March you can have a foot of snow, and the next day you can have 85 degrees. So it all changes.
Exactly. We know that to be true. Absolutely. But what are you going to tell us about today? What are we talking about?
Well, today we're going to talk about if someone's had shoulder surgery and it still hurt, what options you have or what could be the problem. So we thought we'd go through that. I do have a lot of people have been calling me and asking me if I have episodes of old shows that we've done or things in the past. So I've teamed up with this gentleman named Wyatt, and he is helping me to put this stuff on a podcast. So if you are out,
wonderful.
if you're out there and you're listening and you like, you want to learn, like you're listening to what we talk and what we're saying, and you want to learn more, or you miss some spots, or you've got somebody who that you're trying to get to listen to it, you can actually look us up on Delp Chiropractic on Facebook. We're going to post it there today. We're actually live right now on TikTok and on YouTube. So you can look us up. And Wyatt, what is the address for the TikTok and the? If you go to the Facebook, all the links will be there. The Delp Chiropractic Facebook. It's the Delp Chiropractic Facebook. Is that right, Wyatt? Yes, it's all right there, so you can actually look it up right there. And we'll be, like I said, we're live on YouTube, and we're live on TikTok, and then we are going to be posting on Facebook. Hopefully, we'll be live on it real soon as well. So, but at any rate,
wonderful.
So
That's good news, Dr. Delp.
we're trying. We've had a lot of people that keep asking us. A lot of people will call our office and say, "Would you?" They'll ask my girls and say, "What did he talk about today?" And or can you get a breakdown, or you have it recorded? And they'll say, "Well, we don't. We're up front, doing stuff, so we don't actually see or hear what he's saying." So they'll say, "What is it about?" And then I'll call them back, and then but a lot of times it's. You talked about something 3 shows ago. Do you have any? So right now we're going to have them logged. I think last week's will actually be on as well. We'll have a record of that on, I believe, Facebook. So we should have all that up. So if somebody wants to look it up or has questions or has some, wants to find out more about a subject, or I've talked about this medication, or I've talked about this procedure, or I've talked about whatever, it'll be there for you to find out. So. At any rate, so you ready to get this party? You ready to get this party? We're going. I guess that'd make me a high tech redneck, then, wouldn't it? Is that what they say?
Oh my goodness! Yeah, there you go. I like that.
That's right. So you're also going to find out when I'm not nearly as good. I mean, I've got a face for radio. Let's put it that way. So we'll see how this goes on. Being live. So they may say, "Oh my goodness, did his mother have to tie pork chops around his head for the dogs to play with him?" Or you'll know then. Or I've had patients come in. I'm knocking on 50, and they'll say, "I thought you were older," and I'll go, "Well, crap, I'm almost 50, so I don't think I'm that young, but I do appreciate the compliment." So you'll see it.
Thought you was older. Oh,
Older, I was like,
that now?
I thought I'm like, that's quite the compliment. So thank you very much. But at any rate,
That's
so
why you. That's why the wife stays in there close working.
she's keeping an eye on me. She's keeping an eye on me, making sure I'm a good boy, right?
She better. She better.
Well, and if you ever have you ever met my wife, cousin Andy?
I've talked to her on the air, but never met her before. No, I have not out in person.
You ever heard of marrying outside your standard? You ever heard that before?
Yeah, I've heard that a time or two.
Well, she didn't, but I did. Let's put it that way.
You
So
did?
she's a whole lot prettier than I am. I'll put it that way. So she is an absolutely gorgeous girl, and I have to give her credit. Credit's due. In fact, some of my guy patients that come in and they're falling in love. I said, "Honey," I said, she's a pretty girl, but she's mine." So they'll go, "That's your wife?" And I'll go, "Yep, that's mine." I'm sorry. You're fine, man. Hey, I looked too before.
They're like, who's a good-looking lady out there? And Dr. Delp's like, "That's my wife."
That's it's not like a dog where you're gonna start marking the territory, but she's a lot prettier than I am. Let's put it that way. Our kids are going to be are pretty because of her, not because of me. So, at any rate, so I guess we can jump right in. So. Let's talk about so you know someone, or maybe you're considering shoulder surgery. But I've had a lot of people that will they'll have rotator cuff surgery, and they'll go, it's been 3 months, it's been 6 months, it's been a year. They've got a great doctor they're going to, great orthopedic, and they'll say, I'm just not better. I really thought it'd be better than what it was. I know I had a torn rotator cuff.
That's a pretty tough one to recuperate from, isn't it? Shoulder surgery.
The replacement is a booger. So when they do a replacement, it's a booger. But most people have problems recovering from shoulders. In fact, I have a lot of people that'll come to me and saying, "Hey, I had surgery on this one. It's doing better, but I do not want to have surgery on the other one."
Right.
So is there, can you help me? I've heard, I've had my buddies tell me to come see you. I've heard you on the radio. So what options do I have? In fact, this is not related to shoulder. This is related to knee. I just had a gentleman just leave, and he says, my mom, it was a misery for her to recover from her knee replacement, and she does not want to go through that again. He says, and she don't want me to go through that. So can you help me with your knee? So, but anyway, so let's get into shoulder. So actually, give me 1 second. Hey, Wyatt? Well, there. I had a model of shoulder I was going to hold up here on the air, but I'll just have to show you. So, at any rate, with the shoulder, so there's a couple things that can go on. So when they repair the rotator cuff, there's a couple things that goes on. So number one, a good friend of mine that's an orthopedic, there's a model in there that's got a shoulder on it. If you want to ask Sydney to grab it, that way I can show them there if you don't mind. So when people have like this, my buddy, he's ortho, and I was actually going to him. This is several years ago when they started doing the reverse shoulder replacements, and I said, I want you to show me what a reverse shoulder replacement is. I see them on the X-ray, but show me why you do them, why we're doing them now, where they never did them before. You'd see a shoulder replacement, but it was usually on somebody fairly young. It wasn't on anybody older. And perfect. Thank you very much, Sydney. All right. And and they would say, why? I said, so why are you doing it? How do you do it? Because I want to understand the process. Just like when I have when I've got an issue of wanting to understand more about why they're doing a new back surgery or a new procedure, then I called up my buddy who's a neurosurgeon. I said, show me what you're doing, because it's, I want to know why you're doing what you're doing, or why you're putting it in, or why we're having so many failures with this situation, or what's going on. So with him, I called him up. He said, come on down. So I spent the lunch with him, and we talked about it. And I said, so why are you doing these reverse shoulder replacements now versus I'm starting to see them, and I've never seen one before, and I'm seeing them starting to pop up in my office. And he said, Adam, when somebody over the age of 60 years old, and actually it's younger than that, but even over 60, he says almost everyone has a rotator cuff tear, like the supraspinatus, which is the main. If I'm on my side, it actually comes across and attaches like right in here, and it actually, and if you're looking on live on on TikTok or whatever, YouTube, it actually is the first 15 degrees you raise your arm. So if you're raising it like this, that's what the actually does. The supraspinatus is what's actually doing that. Okay. What happens is, and I've always found this to be the case, but it's nice when somebody else backs up what you're saying and we haven't talked about it. You follow what I'm saying? So he said that the reason why they're doing the reverse rotator cuff, reverse shoulder replacement, is because when they go to put a shoulder replacement in, there's nothing to attach that muscle to because the tendon's just shredded. He said it'll be just like, it'll be like fine hairs, and there's nothing to do it, and so you can't attach it. And I said, well, just curious, because I have my own, theories and what I've seen and, practicing for 20-some years. I said, why? How many people do you think has a rotator cuff, sir? He says, all. And I said, all? He said, pretty much everybody will have a torn rotator cuff through their life. It just won't cause them pain, or they may hurt then, but then it heals on its own. But it's still there. So when we MRI,
you said usually around 60 or older, or even before.
Even before,
right?
It's what it is you start looking at people start wanting to get their shoulders worked on by the late 50s, early 60s. But he said, he basically said around the late 50, 60-year-old mark, almost everyone will have. And what he's saying is, when they MRI, there's one on there. And they may not even be symptomatic. They could do one on the other side, and they'll have a torn rotator cuff. Then it's there.
Oh, how about that?
And that's why you'll have people that'll go through this surgery, and they'll get it repaired, and they're like, was not better. Well, that might not have been what was causing the pain in their shoulder. It might have been something else that's causing. There's other things that cause shoulder pain besides the rotator cuff. But as an orthopedic, I'm going to go in. We see that tear. I'm going to go in, I'm going to start putting anchors, I'm going to start pulling stuff up and putting it together, and they're doing their job. They're not doing anything wrong. Don't misunderstand me. Insurance covers it, and then you have it done. When I say insurance covers it, nowadays we say insurance covers it, but you might have to spend $10,000 out of your pocket. It's not like it used to be, where it used to. Well, I don't have to tell you that. It's not like it used to be in the good old days. Yeah. It's really what's crazy is I can have, speaking of that one subject matter, I can have a patient they've got their standard insurance. And then what they'll do is we'll send them for an MRI, and they'll say, I'm not having it done. And I'll say, what's the problem? They'll say, well, it's going to cost me like $1,500 out of my pocket with my insurance. And I'll go, have you thought about filing as a self-pay patient? And they'll say, well, I can't afford that. I said, just call them. I said, they said, what's the difference? I said, about $1,000. I said, what? And a lot of times we can get an MRI for a patient, and I'm not just me. The patient can call up and say, I'm a self-pay patient. How much is my MRI? It'll be $550. But see, these insurance companies set the rates of what you have to charge, so it looks like you're getting a big deal. But honestly, a lot of my self-pay patients are actually paying less than the ones that are actually filing insurance, which makes no sense whatsoever.
It don't.
But we've all heard this. I'm not the only one, I'm sure, that's told you that. I'm just confirming what most people out there have already heard. You'd be surprised how many people come in and we won't even use their insurance and they'll save money. It makes no sense, but it is 2025 or 2026 now, so it's a different world. So when we get back to shoulders, and what we're talking about is when you have an issue with the shoulder, there's a couple things that can be a problem besides the tear. So they did this shoulder surgery, recovered, or you're still trying to recover, and it's still hurting. So one of the big things we see, and that I've got some buddies that are orthopedics, and when I explain this to them, they don't hear this in medical school, which really surprises me when they're in their orthopedic training. You can actually have the shoulders not sitting right in the joint. So I'm going to hold this up for the camera to see. So, well, I think I am. It's disappearing, and this camera's actually cutting it off. But so this is the shoulder, right? So when we look at the shoulder, it actually has a joint. So your shoulder, this is your shoulder blade. If you're looking at me live, the outside is actually got the shoulder joint, the ball of the shoulder, and what it does, it sits in there. When the shoulder can actually roll forward in the joint, and it causes like sharp pain, and that sharp pain is more right over that shoulder. And I'm gonna say shoulder, I'm gonna touch where that's at, which is right in here. Okay, so shoulder is more right here if you're looking at me live, or if you're on the radio, it's more in the actual where you lift and the actually crease of your arm is. If you see what I'm talking about. So that's where that actually slides for, and it causes more of a sharp pain right over the when you lift it, okay? You can also have the scapula, which is the shoulder blade, will actually slide backward, and it can have trouble raising it. So if you take your hand and you put it on the other shoulder and you try to raise your elbow up, you should be able to take the elbow and put it over your head, okay? Well, if you can't, what will happen is if that shoulder blade is actually dropped back, it affects your shoulder raising, get the movement in it, so it puts it in a bind, and you may not bring your elbow up, but maybe I've got some people that barely can bring it up at all. And
Really?
so
How about that?
you got it, and a lot of times when you damaged or torn your rotator cuff, you caused other things to happen as well. So it might not be one thing; it might be a 3-part problem. They repaired the rotator cuff. You're like, yeah, it helped, but it didn't do quite like I expected it to do. We start making changes to the angles in your shoulder and make the biomechanics start to work again. I've seen 80-year-old guys who haven't raised their arm up in 15 years, and they go, I mean, they're starting to cry. They're like, oh my gosh, I can't do this. I couldn't do this. Now I can raise my arm up. They'll have them where you can reach. They can't barely, when after the bathroom when they do their paperwork, if you get what I'm saying. They're having trouble getting around. They start being able to do that. They start being able to move their shoulder in other ways. And a lot of that's where the biomechanics of the joint are not moving correctly. And that can be changed. You'd be surprised how many people that have shoulder surgery, the biomechanics are just not right. And so when we start treating it, they're like, oh my gosh. I've also had people on the other side of the coin that there's a guy that I was at the gym, and he's a good guy. He runs a company here in town, and he was working out. He was talking about how he couldn't, and he was probably, at this time, he was probably in his mid-50s, I'm going to say. This has been a little few years ago. And he was he couldn't work out right because he said he couldn't get his arm up when he's bench pressing. Well, what happened was, he says, they want me to do shoulder surgery. And I said, well, let me check you some things. He says, you want me to check? He said, I'll go see you. He trusted me. So I went and checked him out. I said, I guess this is some issues that I found. We started treating him, and then within a short period of time, he is back in the gym fully, could do everything he wanted to do, and didn't have to have shoulder surgery. Because the main issue was not the tear that he did have. He did have a tear. The problem was it isn't a biomechanics or the way the joint was moving, and it was causing restrictions of motion. It was also causing pain when he raised his arm or moved his arm. That's a biomechanical problem, not a muscle tear problem. So did he have a rotator cuff tear? I'm sure he did. He definitely did. But was causing his problem? In his case, it wasn't. So, but you'd be surprised how many people have shoulder surgery, and then after the fact, they're not responding like they thought they should, and then we change the biomechanics, and they start working again. So that's one issue that can be a problem. The second one is you may start to tear your rotator cuff all over again. So they'll repair it. They'll have issues, and that can also come from an alignment issue in the shoulder, where the shoulder's not moving, biomechanically moving correctly, and it puts it in a bind, and it can actually re-tear that rotator cuff all over again. Just because you have it repaired don't mean you can re-tear it. You can't re-tear it, excuse me. So it can actually come from the alignments off, so it's put in a bind, or you can have weakness that's in your muscle and that's caused from a nerve problem that actually can generate from the neck. And so what that happens is when you start to have a nerve problem, and you'll be surprised when I have people that come in here, we do specific muscle tests that test the nerves. It's actually called a neurological myotome test. So you're testing the strength of that nerve root. So if that nerve's not firing correctly, it's going to come out weak. Well, when you start to lift things, instead of you lifting things like you normally would, like with your bicep, you'll use your shoulder to do that. And what's funny is I'll say, you using your shoulder? No. Their wife's sitting beside them. They go, oh, yes, you are. I watch you do it all the time. You don't physically realize you're doing it. You just do it. It's the old analogy of, have you ever been trying to, like you say, a receptacle cover and it needs to be tightened up? Have you ever used like a butter knife because you didn't have a screwdriver handy?
Yeah. Okay. Yeah, many times. Yeah.
Me too. What tends to happen to the tip of that butter knife?
You break it off.
You bend it. You break it. Mama's not happy. I do it when Mama's not around, so that way she don't see it. Then I don't have to.
I've even done it with my pocket knives. I've used it as a screwdriver, break the tip off of them. I hate to do that.
You just make it, especially if I got a good pocket knife, a good knife.
Yeah.
I'm like, crap, I don't want to mess up my knife. So what happens is you're using something that wasn't designed for that purpose to do something that so you're basically using that knife to act as a screwdriver instead of going and getting a screwdriver, which was designed to do that. Well, the same thing's true with your shoulder. When you're weak and you're trying to lift things up, like say you got a pail of water and you're trying to lift it up, or a jug of milk and you're trying to lift it up, and you're trying to make that bicep fire in your arm to actually lift that up, then what happens is it can't do that. And so you use your shoulder to compensate for it. and that actually can cause all those issues to develop in your shoulder. So you can actually have one problem that causes another one, and because of that, you'll actually tear the rotator cuff again. I've had several patients that's actually had their same rotator cuff repaired 3 or 4 times, and the surgeon did a phenomenal job. I know the surgeons, they're top-notch surgeons, but what's happened is that angles are off because of how they're having to lift things, and it's actually putting in the mind, it's actually starting to tear that muscle or that tendon all over again. So very, very commonly happens. I see a lot of people develop one problem in their neck, and then they'll come and they'll say, well, I've got bursitis in my shoulder, I've got tendonitis in my elbow, and I've got carpal tunnel in my wrist. And they're all diagnosed correctly. However, the problem in their neck's what caused all these other issues to happen, because they'll just keep feeding them steroids, or they'll give them shots of cortisone. And I'm not knocking it. Don't misunderstand me. I've got buddies of mine that are practicing. They're trying to help their patients. You're just providing a little bit of a cover up to help that patient not feel that pain, but you're really not correcting the actual issue. So there's a reason why you have inflammation. The second, or the last but not least cause that we see a lot of times is the pain that's going into their arm is actually not even coming from their shoulder. It's actually radiating from their neck. So they actually, like C6 will actually radiate more in the front of your shoulder. C7 will actually radiate more to the back of your shoulder. And a big telltale sign of this one is it hurts when you're not using your shoulder. So in other words, you're sitting at your desk, it starts to ache. A big one I hear people is they're watching TV at night. They'll say, man, my shoulder's just aching. It just drives me nuts. A lot of times there's radiating pain coming from your neck. Kind of like, have you ever heard of somebody who says they had a heart attack and then all of a sudden they're actually hurting down their left arm? You ever heard that before?
Oh, yeah, yep. Absolutely.
That's radicular pain or radiating pain. A little different because this one actually, that nerve actually comes out of here and goes through the back and then kind of comes across. C6 comes more through the front of your arm. C7 goes down more the back. And those are things that can actually cause it to ache and cause problems to radiate into that. So another one is it hurts at night. Say they'll people say, I can't sleep on my right shoulder, and you'll be surprised. A lot of times that's actually radiating pain coming out of your neck, and they'll have, we'll start treating their neck, and they're like, I can sleep again on my side, and you're like, well, excellent. Then that's what we're wanting. So that knows we're going the right direction. Another one sign is that if you have weakness in your hand. What I mean by that is your grip strength's off when you're opening up cans. That's a real big one. Like you're doing anything with your grip, like you're shaking or holding on to stuff, or say you're carrying groceries and you'll want to need to set them down because you feel like you can't hold on to them. Another one I hear a lot is, say they're buttoning the buttons on the top front of the shirt. They can't, it's like their brain's wanting to do it, but their hand won't. It's like it's trying to talk, but it can't do it. Handwriting is affected. I got a buddy of mine who was a contractor, military contractor, and his shooting would get off. And so I would actually be at the range shooting with him, and he would say, God, I'm missing. And I would check him, and I'd say, and then we could treat him. And it literally, you would actually see him within minutes, his shooting would go back to normal. And he's like, dude, I'm off. Would you fix my neck so I can start shooting again? Right. She's, so that can actually cause weakness in your hand. It can cause your dexterity or the control of your hand to be affected. So like if you're writing, you'll be more shaky or you'll tremble. And then people say, well, I'm just getting older. And it may be that case, but you'd be surprised how many are not. It actually is generating from a nerve issue. So that, like your grip strength, you'd be surprised the people that I have that are 90 years old. In fact, a lady goes, it's literally, she was in my office yesterday and she's like, I'm 90. I just can't, I can't do what I used to do anymore. And I said, and she says, I bet you I'm the oldest patient you got. I said, honey, I've had 5 90-year-olds this morning. So I said, and they'll hop on the table, get up and get down and can do things they didn't realize they couldn't do because if they go somewhere, everybody tell them it's their age. And sometimes it is, but you'd be surprised how many times it isn't. And there can be things changed to do that. So the other option is if you're trying to prevent surgery, you can change the angles in your shoulder to reduce the damage on the rotator cuff and actually not cause that bursitis. It also repair the damage. We can actually, there's new technologies available now that will actually repair the damaged cartilage in the shoulder. And so that way that it'll actually grow. It forces your body to send stem cells in the area to repair the damaged tendons, the damaged muscles, the cartilage that's in there that acts as your tissue. It actually can can make a huge difference in that. So there's a lot of new technologies out there that before we didn't have. However, now we do. So a lot of options out there. So any other questions you can think of, Cousin Andy?
I can't think of anything right off, Dr. Debbie. You really covered that well.
Well, good. So and those are some things. So if you've had issues and you're looking for solutions, there are other options. So just, keep your, don't get depressed. I have so many people that are looking for hope because they've just given up and they're just sick and tired. They love their doctor, they love their surgeon, but they're just not getting better. There are options. You got to find the right kind of person that does that. If you're having issues and you want me to evaluate you, I'd be glad to evaluate you. We do. A lot of people go, "You're not like a normal chiropractor," and I go, "I know. I do chiropractic, but also I've had training in internal medicine and I've done a lot of training in neurology. So we do a lot of things other than just chiropractic." But so if you're having issues, we have a lot of new technologies that can do things that a lot of people don't have. So I literally have a lady that's drove 4 hours from West Virginia. And then I have people like in a day we have them, we had 5 or 6 one afternoon. In fact, I said, this is the Crumpler crew out here. They're all coming from Ashe County, and I had 4 or 5 people. They said, we need to ride together and save some gas. So people come from all over. So if you have issues that's not getting better, let us know. I literally had 3 people from Greensboro yesterday. So just if you're having issues, just let us know. We'd love to evaluate you and see if you're a candidate. If I can direct you somewhere else that can get you relief and you don't have to see me. And there's some times where you come in and I go, hey, unfortunately we're going to have surgery done on this. But the good thing is probably I don't have to say that as often as I can say, hey, we can keep you from having to have surgery. So that's what most people get excited about, because the recovery time and the cost nowadays, even insurance covers it, like we was talking about before. There's so much cost that people don't expect to come until they get their bill in the mail. Other than that, any other questions you can think of?
Just make sure to let them know how to get an appointment, how to schedule with you, Dr. Delp, if they are needing help.
Absolutely. So if you need to give us a call, we are here in good old Mount Airy, a.k.a. Mayberry. You can give us a call. Our number here is 336-786-5555. That's 336-786-5555. And we'd love to evaluate you and see if you're a candidate for treatment. And anything we can do to help you out, please let us know. If you, we want to find out more information, or if you missed something from what we talked about, please look us up on Facebook. It'll be posted just shortly. Within probably a few hours, I would say it'll be up and active. Or that we're live right now on TikTok. You're running to the end of it. I don't know if you can pull that back up. I have a gentleman that helps me out, Wyatt, that is a techno-savvy individual. I still get mad if I have to text people too much. I say, just let me call you. Let me call you. If we're going to, let's not text back and forth. Let me just pick up the phone and call you. I got a good friend of mine up in Dougspur, Virginia, named Wormy. And I say, Wormy says, don't text me. I say, I know you're not going to text me back. That's not a problem. I'll call you, Wormy, because I could get rid of that thing. I could throw it out the window to myself about half the time. So, but at any rate, I'm going to hush and get off here. Cousin Andy, you have well, go ahead.
You too, Dr. Delp. Appreciate it a lot. I hope you have a wonderful day. I was going to tell you, though, the best thing about texting, when somebody texts you from your own house, your wife, your kids. You ever get that?
I'm sitting beside of you. Are you kidding me here? Like, can you literally get up off or the best thing is, have you ever been texted by your wife and you're like, what'd I do to tick her off? And you're like, and it's funny. This is a few years ago, but I was like, we were, I was like, what's your problem? She's like, what's your problem? I was like, you're the problem. She's like, you're the problem. And what it was is all from a text that was misunderstood. And I was like, this is what you said. And she's like, that's not what I meant. And you're like, well, that's what it says. But because you don't have the inflections in your voice. And that's how we tell. And these young kids, I really feel sorry for them, because they're not developing that ability to understand, and they just text back and forth. They don't actually talk. And so when you come in, they take things the wrong way. I had a young girl
that's where you get the drama from.
Oh, you're like I've had many people that say, they say, well, I was there, and they said they said something sexual to the other person. I was like, no, they didn't. The younger person just didn't understand that they were cutting up, joking around. You know what I'm saying? They're like, no, they didn't mean anything about that. So, but
be careful of those text messages you send out. So
you do. You better make sure if there's a fight, say, hold on. let's go back and let's reevaluate that again and make sure that's what I meant to say or what you meant to say before we hit the DEPCON 5, right? Or DEPCON 4. Is it DEPCON 5? DEPCON 4? Of course, right now, I think we're, we've been at almost World War for like the last, 4 years with, the last thing in, Russia, and now we're in Iraq. So it's always something fun and exciting. I feel like I'm watching the news every day, but it's, you're like, holy cow. I feel like I'm reading out of Revelation in the Bible. You're like, oh my gosh, any time this thing could pop, so you could, you better know who your Lord and Savior is, right?
Amen to that.
That's it. That's it.
That right.
That's it. Well, hey, I'm
good to talk to you.
Hey, good to talk to you. You have a great day and enjoy your afternoon. And thank you very much.
Thank you, Dr. Delp. Thank you much. Be safe.
Bye-bye.
98.1.
All right. What do I need to? How do I shut this thing down? So you said there might be some people that are on here. Somebody's wanting to co-host. I don't understand that. Okay, yeah. I figured that was some junk.
There's nobody on here, so you're good. Zero.
All right.
Right now.
Okay.